Well, good afternoon, everyone, and thank you and a warm welcome from Geneva to the WHF webinar on the 70th World Health Assembly. My name is Jeremiah Mwangi. I'm the Director of Policy and Advocacy here at WHF, and giving the webinar with me today is Alistair White, our Advocacy Assistant. But before we begin, I would like to give a warm welcome and the floor to our new CEO, Jean-Luc Aizelet, who will introduce himself and say a few words. Jean-Luc.
Thank you, Jeremiah. Good morning, everyone. I understand that we have guests from the United States, so welcome, everyone. I think it's an important event, probably the most important event in terms of global health, this World Health Assembly, which will take place in Geneva. And we very much appreciate your input and the fact that some of you will be present in Geneva. I'm sure we'll have the opportunity to welcome you and discuss with you how WHF can better serve your member needs and the members of the CVD community globally. So I'm very pleased to be with you today. I'd like to leave in a few minutes, but I'd like to thank also Jeremiah and his team for the fantastic work they've been doing in preparing this briefing and all the work behind it in terms of all the side events and all the opportunity you'll have to meet with member states, missions, and other NGOs. So thank you very much for your interest, and I'm looking forward to welcoming you in Geneva in a couple of weeks. Thank you.
Thanks, Jean-Luc. So just before we begin, a quick note to everybody to say we are recording this webinar, so you'll be able to share it with your colleagues who might also be interested in the details about the content for the assembly. So just to quickly run through today's agenda, we'll start with a quick overview of the assembly and the main reasons and objectives for WHF's participation. We'll talk a little bit about the agenda and the key agenda items that we are tracking this year, as well as, I'm sure many of you will be interested, the voting process to decide the new WHO Director General. And then I'll talk a little bit as well about some of the side events that are taking place during the assembly, and we'll also have a section on logistics and some of the practicalities. So just quickly to go into the overview, as the majority of you will probably know, the Assembly is the main decision-making and governing body of the WHO. It meets every year in Geneva in May, and the agenda is largely determined by the Executive Board meeting, which takes place in January, where the Executive Board members made up of member states and NGOs, including WHF, gave their perspectives on various different topics in global health. The main function of the Assembly is to determine WHO policies, and part of that is about looking at what WHO is doing and should be doing and how well they've been doing, but also providing guidance to governments and agreeing between governments on actions that they should collectively take on a range of health issues. They also review and improve the WHO budget, which is a very important area. As we know, the NCD department, which we have been most interested in over the years, although it's had a lot of attention on the technical side, when we look at the budget, there's actually not a very large amount going towards NCDs. And they also consider reports from the EB and decide the next steps. A couple of points on why we're attending. Clearly it's important that we keep an eye on the main issues in global health. We want to, of course, influence the discussions that take place, so we can do that by providing an opinion on those issues through statements and side events, and also by talking to decision makers and having meetings with the different governments and different stakeholders. So particularly in this case at the Assembly, member states send their often ministers of health. So again, it can be an opportunity to influence the way they're thinking and the direction that they're giving to their ministries overall. We also work to network and build up contacts with officials at the Ministries of Health and the missions here in Geneva putting across our kind of key messages and asks. And also, we think it's very important that it's not just that we ask member states for things, for resources and for political commitments, but that we also demonstrate how WHF and its members can also assist member states. And part of the way we do that is also by using the opportunity to profile the work of our members. So if we look at the agenda and some of the key agenda items, you'll see that we've put here some of the times or dates when we expect these items to be discussed. And so all of these will be tracking during the week and we'll provide feedback on after the assembly. So as you'll see, the voting on the next Director General will take place on Tuesday. It's a closed session, so unfortunately we can't attend, but I'm sure we'll all be eagerly waiting to find out the results of that. Under the health systems agenda item, we'll be making statements on 2 items. Discussions on these items are currently scheduled to take place from Wednesday to Friday. So you can see there addressing the global shortage of and access to medicines and vaccines and promoting the health of refugees and migrants. Under the non-communicable diseases strand of the meeting, we will be following discussions on preparations for the UN high-level meeting on NCDs with particular interest. And those discussions are due to be held from Saturday to Monday. And then finally, we will be making a statement during the discussions on the global strategy for women's, children's and adolescents' health. And these are due to be held during the 2nd week of the meeting. So that's just a quick overview, and I'll now hand over to Alistair, who will go into more details on the items mentioned on this slide.
Thanks, Jeremiah. I'll start with the post of the Director General, which is certainly one of the most eagerly anticipated items of the week. From an initial list of 6, the Executive Board nominated 3 candidates to be considered for the post. They are Dr. Tedros Adhanom Ghebreyesus from Ethiopia, Dr. David Nabarro from the UK, and Dr. Sanya Nishtar from Pakistan. This agenda item will be held on Tuesday, the 23rd of May, so this will be the main focus of many member states for the first couple of days of the meeting. Each candidate will make a statement lasting a maximum of 15 minutes, which is also webcast, though there won't be any opportunities for questions or answers following their statements. These will either be in the morning or the afternoon on Tuesday. It's currently unclear as the Secretariat's report on this item and the preliminary timetable say different things. So if you'd like to tune in for these, make sure to check for updates. A link to the webpage where daily timetables are uploaded is there at the bottom of the slide. As Jeremiah mentioned, unfortunately, civil society are unable to attend the afternoon session as attendance is limited to member state delegations and the UN and WHO secretariats. Moving on to the voting itself, this takes place by secret ballot and by paper-based voting. So for this reason, it can be a lengthy process and it may take the whole session. If on the first round of voting, any candidate receives a 2/3 majority, they'll be elected as Director General. If not, the candidate with the fewest votes is eliminated and the vote is repeated. And then in the second round, one of the remaining 2 candidates has to just achieve a clear majority. The new DG will then take up his or her post on July the 1st, 2017, and this is for a 5-year term. The first item to be discussed during the meeting, where we will make a statement, is 13.3, addressing the global shortages of and access to medicines and vaccines. Work on this agenda item was kick-started in December 2015 by a global consultation on stockouts and shortages, which was convened by WHO. Member states then adopted a resolution on this item at the 69th WHA, so last year, mandating WHO to begin work to harmonise and standardise definitions of shortages and to coordinate a global response for access to medicines. Through a systematic review, WHO has produced global and harmonised definitions of supply-side shortages and demand-side shortages, which were included in the EB's report. The Secretariat have also updated this report for the World Health Assembly, and this updated version places more emphasis on access to medicines as a broader public health issue, which with importance to all WHO's areas of work, and in particular notes its relevance to NCD prevention. In terms of next steps, WHO plans to conduct a broader member state consultation in 2017 regarding its definitions of shortages, and this will include a special focus on including stakeholders from remote locations and countries with small markets. Our first key message on this item is for member states to continue to invest in robust health information systems to monitor and report the burden of CVD at the national level, which is in close alignment in particular with our World Heart Day global policy call to governments. Our second message is for member states to work with all stakeholders, including the pharmaceutical industry, to increase manufacturing capacity of generic formulations of essential medicines. The urgency of this need is demonstrated by the fact that nearly 70% of CVD patients in lower and middle-income countries currently do not receive the medicines to manage their conditions. And finally, our third key message is a call for governments to prioritise the procurement of essential CV medicines in national health budgets. We will also deliver a statement on 13.7, promoting the health of refugees and migrants. First, to give you some background, as there are parallel discussions taking place on this topic, both within WHO and in a separate process which is led by the UN. In September 2016, the UN General Assembly convened a high-level meeting at which the New York Declaration for Refugees and Migrants was adopted. This declaration included two annexes, which paved the way for two global compacts, one on refugees and another on migrants, both scheduled for 2018. And the UN has organised a series of multi-stakeholder hearings in New York, Vienna and Geneva later this year to prepare for the Global Compact on Migration. Turning to work led by WHO on this issue, the issue of health of refugees and migrants dominated the EB, with parallel discussions taking place throughout the 10 days. In the end, the member states adopted a draft resolution on promoting the health of refugees and migrants. In this resolution, it asks the Director General to set out priorities and guiding principles on this issue at the 70th World Health Assembly. These are expected to be included in the WHO Secretariat's report, which hasn't yet been released. In terms of next steps for WHO, in partnership with member states, UNHCR, IOM, and several other international organizations, WHO will draft a global action plan on the health of refugees and migrants, and this is to be considered at the 72nd WHO in 2019, so in 2 years' time. We have three main key messages on this item, which is firstly to integrate migrants into national health systems as quickly as possible. Secondly, to invest in research into chronic conditions among migrant populations. And thirdly, to encourage task sharing and task shifting across the health system. One extremely important agenda item for us will be the first item under NCDs, preparation for the UN high-level meeting in 2018. As many of you will know, the first high-level meeting on NCDs took place in 2011, where member states adopted the UN Political Declaration on NCDs, and this was then followed by the second high-level meeting in 2014, where member states agreed 4 time-bound commitments to be achieved in 2015 and 2016. However, few member states have fully met these commitments. The Secretariat's report, again for this item, is yet to be released. However, we expect it to contain many of the issues included in a draft resolution which was discussed by the Executive Board and recommended to the World Health Assembly. These issues include a request to the Director General to submit a report on preparations for the high-level meeting to the World Health Assembly in May 2018. We would also expect the Health Assembly to note the work plan for the Global Coordinating Mechanism. That will be the work plan for the years 2018 and 2019. And it may also endorse the updated Appendix 3. However, in the EB's resolution, there were a couple of sections that were still in brackets, meaning that these would need to be resolved during World Health Assembly discussions before it is fully endorsed. We also understand from the NCD Alliance that the Secretariat's report may also include a reference to the upcoming Global Conference on NCDs in Uruguay, which in October later this year. Regarding next steps, the new WHO Director General will submit a progress report on NCDs to the UN General Assembly in November 2017. During a previous webinar that we hosted in March, we went into more detail on preparations for this meeting. So if you would like more information, please follow the hyperlink there on the slide when we send around the slides in PDF form following the presentation. And you can also find this webinar on our website. Our key messages on this item are firstly, that progress has been insufficient and uneven. The report at the EB in January noted that 138 member states out of 194 had shown very poor or made no progress in meeting the 4 time-bound commitments. So for this reason, we are calling on countries to fast-track their efforts to meet targets in the lead up to 2018. And finally, while this high-level meeting is a global event, the real focus is on national action, which is vital to ensure that countries achieve progress in tackling both CVD and NCDs. And the final agenda item where we will be making a statement is 16.3, the Global Strategy for Women's, Children's and Adolescents' Health. This was launched in September 2015 as an implementation platform for Sustainable Development Goals. And then in May 2016, the WHA adopted a resolution which committed member states to implementation of the strategy. In the Secretariat's report on this item, it's noted that high-quality data are routinely collected for only a few of the 60 indicators, which highlights the urgent need for investment in civil registration and vital statistics and country health information systems. It also notes that by March 2016, only 60 governments had made commitments to implement the global strategy at the head of state or ministerial level. In terms of next steps on this item, Member States agreed a theme on early childhood development for next year's Executive Board in January. This follows the focus on adolescent health at this year's Executive Board and Health Assembly. Another key thing to note is that the report and recommendations of a high-level working group for the health and human rights of women, children and adolescents will be launched during the WHA at a side meeting on Monday the 22nd. We are still preparing our key messaging around this agenda item and we'll share this with you via the website as soon as possible. The main reason for this is that we are making more changes to the statement to give it a broader CVD focus at the World Health Assembly, having focused primarily on rheumatic heart disease in our statement on this agenda item at the EB. Before I hand back to Jeremiah, who will take you through some side meetings, I'll just briefly mention a couple more agenda items worth noting. The first of these is the address by the Director General, Dr. Margaret Chan. This is worth tuning in for, as it will be her final address to a World Health Assembly as she finishes her term at the end of June. For those of you following the meeting by webcast, this speech is likely to start at around 2:30 in the afternoon European time, and the link to the live stream is there at the bottom of the slide. There are a couple of further items under NCDs which we'll also follow with interest. The first of these is the implementation plan for the report on ending childhood obesity. This is a report that WHF initially fed into in 2015 and then endorsed the comments led by NCD Alliance at the end of last year. This draft implementation plan received positive feedback at the Executive Board, so we would expect this to pass during the World Health Assembly, but nevertheless we'll be following developments closely. Another item which was not included at the EB is 15.7, strengthening synergies between the World Health Assembly and the Conference of the Parties to the WHO Framework Convention on Tobacco Control, which took place in Delhi in November last year. The main outcome of this meeting was the Delhi Declaration, which calls for increased efforts to prevent interference by the tobacco industry, and this report is mainly a report from the President of the COP. And then finally, the Health Assembly is also invited to note a report on progress in the 2030 Agenda for Sustainable Development. This report assesses progress towards achieving Health Goal 3 of the SDGs and also implementation of a resolution on this agenda item, which was passed at last year's World Health Assembly, which, among other things, calls for increased health system strengthening, more financing and strong accountability mechanisms. Member State progress towards Goal 3 in the 2030 Agenda will also be evaluated at the high-level political forum in New York, which takes place in July this year. I'll now hand back to Jeremiah, who will take you through a couple of side events that WHF is co-hosting during the week.
Thanks, Alistair. So, as you mentioned, there are two events that WHF is co-sponsoring or co-hosting. The first one of those is called Better Medicines for Children. This one we're co-hosting with NCD Child and UNICEF, among others. The focus of the session is to address the challenges and potential solutions to improving children's access to key medicines and equipment. So that's really something that we've, as we mentioned already, been looking at through the global strategy on health for maternal health, children and adolescents, but also a part of the work that we've been doing on rheumatic heart disease. So the event will be opened by Jonathan Klein, the Executive Director of NCD Child, and there'll be a keynote speech from the President of the International Pediatric Association, and then that will be followed by a moderated panel, and the participants on that panel include Jeff Stercio from Rabin Martin, the Director of NCDs from the Ministry of Health in Sri Lanka, and then the speaker who we had invited and put forward to be on the panel, who is Flavia Maturene. She's a nursing officer from the Uganda Heart Institute. She is someone with living with rheumatic heart disease, but is also a rheumatic heart disease nurse. And so she's going to talk about patient counselling, drug adherence, and challenges to consistent access to medication. So we think that she will be an excellent speaker and has a lot to share that really throws into sharp relief the importance of tackling this issue. And the fact that the event will be concluded with a few words from Dr. Kate Armstrong, who's the president of CLAP. So that's on Tuesday the 23rd of May. It's at 8 a.m. until 10 a.m. and it's in the Vieux Bois restaurant just outside the entrance to the Palais. If you're interested in attending that event, then please just drop myself or Ali an email and we can make sure that you're on the invitation list if you haven't received one already. The second side event, which we are co-hosting, is called Global Heart Health and the Road to 2025 and supporting a heart healthy agenda for the age of longevity. This event will really look at the current progress towards meeting the 25 by 25 goal, particularly from the policy standpoint and looking at some of the barriers that have kind of halted the progress in some cases towards 25 by 25. So we're co-hosting this event with the International Alliance of Patients Organizations and DevEx. For those of you who haven't heard of DevEx, they're an online media agency with a focus on development issues. In terms of the program for this event, it will be moderated by a representative from DevEx, Richard Jones. Speakers will include the Senior Editor and Global Editorial Lead for Healthcare from The Economist, Martin Coring, who will be presenting the Heart Healthy report that they've just concluded. We'll also have Patrice Machaba from the Head of Global Development from Novartis, Carlos Castro, and the President of PACO and IH Hub, so bringing the patient perspective. Dr. Yeri Anuma from WHO will speak a little bit about global hearts and how that will contribute towards 25 by 25, and there will be a speaker from IAPO. So I think everyone should have received the invitation to this event through our mailing list, and there was a web link there where you could sign up and register. So if you are still in town, then we do recommend that you come along.